A slow rhythm originated in the SA node. Sinus bradycardia. Treatment of sinus bradycardia is directed towards two things: the primary cause of the problem and maintaining cardiac output. An antispasmodic used in sinus bradycardia to increase the heart rate. Atropine. Temporary or permanent implantable device for sinus bradycardia. A pacemaker. When P waves are irregular and the line is absent. Atrial fibrillation. In phlebotomy, what is the gray tube used for? Glucose. This is characterized by a heartbeat of 100 to 150 per minute. Sinus tachycardia. What node delays impulse which allows ventricles to fill? AV node, the atrial ventricular node. Impulse splits down right and left in septum between the ventricles. Bundle of His. What side of the heart pumps through arterial system to deliver O2 blood to body via arteries? The right or the left side? Left side. What may be caused by the needle going through the vein? A hematoma. When drawing blood, where do you start? At the top, at the median cubital. P wave rate greater than 100 beats per minute. Sinus tachycardia. Which vein is the third choice? Basilic vein, inside the arm. Which vein is the second choice? Cephalic vein. Rest of heart filling with blood. Depolarization or repolarization? Repolarization. What's the first thing you do when reading the EKG? ID the rate and regularity of rhythm. What originates in the SA node and precedes each QRS complex? What wave? P wave. The interval between atrial and ventricular contractions. PR interval. What is ventricular depolarization? What complex? PQRS complex. Exercise, anxiety, fever, hypothermia, shock medications, and heart failure cause what? Sinus tachycardia. Puncture to withdraw blood for venous specimen except arterial sticks. Phlebotomy. Guidelines for a foot site. You need a doctor's order. Puncture sites you do not use. Burned areas and if there's an IV in the arm. Mastectomy patient, stroke patients, dialysis clients, and edema or scarred areas.
When's Joe Bill gonna have your car?
You don't want to use them because you don't want to use those affected extremities. What do we need heel sticks for? Infants. Who do we need heel sticks for? Infants. This is characterized by a pulse rate less than 60 beats per minute. Sinus Bradycardia. When the ventricles contract, depolarization, what is that? What wave is that? QRS complex. The QRS interval time, less than 0.10 seconds. Left and right side upper chambers are called atrium. Where do the left and right coronary arteries branch off to? The aorta. Branch off of, aorta. Atria contract, depolarization, what wave? P wave. When atria is quivering with irregular QRS complexes. Atrial fibrillation. Cardiac surgery, long-standing hypertension, pulmonary embolisms, arteriosclerosis, mitral valve disease, heart failure, cardiomyopathy causes what? Atrial fibrillation. Medical treatment of AFib. Digoxin and Lanoxin. Rapid regular rhythm originating in the SA node. Sinus tachycardia. What is the clot tube? The tiger top or the red top? If glucose test is over 400, call the doctor. What color is that test tube? Gray. So what is the tiger top tube used for? Chemistry test. What is the blue tube used for? PT, PTT, and coagulation. What treats atrial flutter? Digoxin and Lanoxin. Atria quivering with irregular QRS complexes. Atrial fibrillation. Ventricular repolarization. What wave? T. So what is the T wave? Ventricular repolarization. Normal sinus rhythm. What's the rate? 60 to 100. Name 3 other methods of blood collection. Capillary tube, microcontainer, and heel sticks. What pulls blood and helps visualize a vein? A tourniquet. You don't use a vacutainer or tourniquet on what? Fragile veins. A normal electrical heart activity must have how many waveforms? 3 waveforms. The main pumping chambers. Ventricles. Continuous network of vessels. Circulatory. When the ventricles relax, also known as repolarization, what wave is that? The T wave. We're gonna drill this in, okay? So, another word for the electrical system. Alright, so, another word for electrical system. Conduction. This is a wiring system that conducts the heart. Conduction. A system of arteries and veins which supply heart with oxygenated blood and metabolic nutrients. Coronary. What's the PR interval time? Less than 0.20 seconds. Inferior lower atrium by septum. Inferior atrium, that's by the septum. What node is that? AV node. Okay, so the upper and lower chambers pumps in synchrony separated by what? The septum. When is sinus tachycardia alarming? When it's above 150 beats per minute. What is the lavender tube used for? A complete blood count. What is the red top tube used for? Complete metabolic panel. What tests blood sugar and hematocrit? Capillary test. Anaerobic or aerobic is drawn first? Anaerobic is drawn first. All right. What precedes the QRS? The P wave. Several P waves to QRS. No pattern or relationship noted. What is happening? A complete heart block. So when uniform P waves are indicated, what is that? I mean, uniform P waves indicate what? Atrial flutter. What side of the heart pumps and receives the returning blood from the body through the vein? The right side. Slow rhythm originated in the SA node. Sinus Bradycardia. Alright, so when the ventricles quiver instead of contract, myocardial ischemia, heart attacks, untreated VTAC, and heart disease causes this. And an acid-base and electrolyte imbalance, electric shock hypothermia. Okay. Ventricular fibrillation. A heart defect at birth. Congenital heart disease. A life-threatening rhythm that has irregular waveform, chaotic patterns of electrical activity in ventricles, and without treatment can cause sudden cardiac death. Ventricular fibrillation. Increased myocardial irritability, myocardial ischemia, heart attack, CAD, heart failure, valvular heart disease, cardiomyopathy, electrolyte imbalances like potassium, and drug intoxication. Ventricular tachycardia. Pronostil, lidocaine, and antidysrhythmic drugs treats what? VFib and VTAC. Treatments of VFib and VTAC. There's 3. Defibrillation, shocking of the heart, pronestil, lidocaine, and antidysrhythmics drugs. Okay, this is life-threatening rhythm that is extremely unstable and has irregular waveform. VTAC. Stress, exercise, electrolyte imbalance, digitalis toxicity, hypoxia, and myocardial infarction causes PVCs. What delivers an electrical impulse to the heart muscle? Pacemaker. What appears as a vertical line before the QRS complex? Pacemaker. Weakened or necrotic area of the heart. Ventricular aneurysm. High frequency ultrasound of heart valve. Echocardiogram. Continuous 24-hour monitor client, and you want to keep the diary. What kind of monitor is that? A Holter monitor. Ectopic beats, which originate from the ventricles. Premature ventricular contraction, PVCs. When a ventricle is irritable, related to caffeine or stimulus. Premature ventricular contraction. What can PVCs lead to? VTAC or VFib. What treats PVCs? What treats PVCs? Antidysrhythmics drugs. Range for a gauge needle when drawing blood. A 22 to 20 gauge. CMP tube color. Red. Acts as receiver from body. Atriums. Left and right side lower chambers of the heart. Ventricles. Stimulates the heart to beat. SA node. Pericarditis. Heart catheterization. Pictures to detect blocked areas. Cardiac angiogram. Bypass path for blood flow to heart. Ischemic areas. A cardiac artery bypass graft. Cabbage. Plaque buildup on inner walls of the coronary arteries. CAD. Myocardial infarction resulting from blockage of blood flow to the heart. Myocardial infarction. What causes right and left atria to contract? When the SA node fires. Refill with blood. What wave? T wave. Two valves between atria and ventricles. AV valves. Atrioventricular. Two valves leading away from the heart. Semilunar valves. What makes the lub-dub sound? Closure of the valves. The electrical system activates depolarization, which is contraction. What electrical system is this? Conduction. Upper right atrium, also known as the pacemaker. SA node. Terminal portion, fingers throughout the wall of ventricles causing contraction. Purkinje fibers. Chest pain. Angina pectoris. Failing hearts. Congestive heart failure. Treatment of crisis hypertension. You want to keep them calm, quiet, call a doctor, and give hypertension medicine. What kind of medications do you want to use for lowering pulse pressure? Meds that decrease cerebral edema. Blood pressure systolic number dropping to diastolic number. Example 130/80 to 110/80. Narrowing blood pressure. Trendelenburg cooling blanket, IV antibiotics, antipyretics after blood cultures treats septicemia. Bacteria in the circulatory system, results same as shocks, signs and symptoms except elevated temp. Septicemia. The first choice vein. Median cubital. What kind of needle can prevent hemolysis? Nothing less. What kind of needle can prevent hemolysis? Nothing less than a 23 gauge. What alters potassium and lactic acid? Tourniquet. A tourniquet on longer than 1 minute. The arm may appear swollen because of the accumulation of tissue fluid. Edematous tissue. SA node is not functioning as fast. Bradycardia. Another name for digitalis. Lanoxin. AFib. What are the waves doing? What waves are doing what? P waves are firing fast during AFib. Okay. P waves are irregular and rarely seen. Okay. P waves are irregular and rarely seen, but you treat it with digoxin or lanoxin. Atrial fibrillation. What is happening on the T waves? T waves. What's happening? Rest, refill, and repolarization. Electrolytes that are involved with the heart. 3 of them. Potassium, chloride, and sodium. Capillary collection site. Middle finger and a ring finger. Lancet depth. No more than 3 millimeters. Where does the white lead go? Right arm. Where does the black lead go? Left arm. Where does the red lead go? Lower chest. Which atria has the pulmonary veins? Left atria. What do the valves do? Prevent backflow. Beginning of the QRS, what node? AV node. Bundle of His and Purkinje fibers. We're talking about PQRST. Which one? QRS. Heel puncture depth. Max depth is 2 millimeters. What test cannot be performed on blood from a capillary collection? Blood cultures and coagulation test. Preferred method for obtaining blood from newborns and infants. Capillary collection. An increase in the ratio of formed elements to plasma. Hemoconcentration. An increase in the ratio of formed elements to plasma. Hemoconcentration. Repolarization is what wave? T wave. Atria fires during what wave? The P wave. Yeah, we already did that. All right, that's it.